There is a new COVID variant spreading throughout the country, the strain earning the nickname razor blade throat. COVID is due to its main symptom. That's scary. Dr. Robert Citrenberg is an infectious disease expert with Advocate Healthcare. Thank you, doctor, for joining us.
Thanks for having me.
Razor blade throat. That is so scary, the sound of it. Will the COVID vaccines, take care of that? Current ones?
Well, it's an interesting symptom. So it does appear that the current strain of COVID that's circulating, which we call the Nimbus strain, does produce a pretty severe sore throat. Now, it's not the first virus ever to do that. There's been lots of viruses that can do that. And it's important if you have that severe sore throat to get checked out to make sure it's not a strep throat, which can also have similar symptoms. So the COVID vaccine still does help to prevent more serious illness, hospitalization, and death, but it's unclear right now if it has specific effect on this sore throat. But I think the important thing is if you have a very severe sore throat, like this so-called razor blade throat, it's a great idea to go to your doctor, get checked out, have them look at your throat, and do a throat culture if necessary.
Just in case. Is this more contagious than the other strain?
It does appear to be. So it's the good news is that it does not appear to cause more severe illness. In fact, it causes fairly mild illness compared to prior strains of COVID. It does appear to be more transmissible. So what we'll see is maybe a larger number of people with more mild disease compared to strains in the past.
Now, a lot of people worry because the new COVID recommendations have changed quite a bit since RFK got in in office, Health and Human Services. Tell me this: it says it's not recommended for healthy children, not recommended now for pregnant women. But does this all change with this new strain?
I don't think the new strain's going to change any of the vaccine recommendations, and there's still a role for COVID vaccines, and particularly for kids between the ages of 6 months and 17 years. We recommend what we call shared clinical decision making, which is where the parents and the patient talk to their doctor about the benefits of the vaccine. And the same is true with pregnant women as well, too. For anybody who has questions about the COVID vaccine, if they want to know if it's the right thing for them, we encourage them to talk to their doctor and have a conversation about it.
What are your thoughts on the new recommendations?
Well, I can tell you that our recommendations haven't really changed very much. From in our own organization. We still recommend COVID vaccine for patients who are at most risk for getting severe illness, hospitalization, and dying, which are principally those with weakened immune systems. There's still, even though we don't talk about COVID as much in the community, there's still a fair amount around, particularly in those people with weakened immune systems. So those people should absolutely get a COVID vaccine. And others who feel that they may be at risk for severe COVID should just talk to their doctors. But our recommendations really haven't changed that much with the new guidance.
You talked about, we don't talk about COVID as much, and things are really blurry now as far as how many you should take or how many you should have. Where should we be on our COVID vaccines? Because, I know I got 1, 2, 3, 4, and then kind of stopped.
There's a new update that's pretty much available every year. The current one that's available is the 2024-2025 vaccine. So typically, when the new one comes out, it's time to get a new one. If you're eligible for a COVID vaccine, that's the time to do it is when the new vaccine comes out.
And this one, this new Nimbus or the new razor blade throat thingy, it's, from what I understand, it could cause more long COVID than the other strain, right?
Honestly, I think it's a little bit too early to tell. This
Okay.
is a fairly new observation,
Okay.
but we do know that long COVID is still a thing. It's still an entity, but it's unclear right now if this particular strain and those who get this so-called severe sore throat are more likely to get long COVID.
And summer times here, we don't usually get colds, we don't usually get the flu, but if you think you've got something and you think it could be strep throatish, go to your doctor, right?
Yeah, that's right. And the other wintertime respiratory viruses really aren't present this time of year, but COVID is really present all during the
Yeah.
year. It starts to pick up, especially late summer into the fall. So it's with us all year long.
All right. Dr. Robert Citrenberg, we appreciate it. Thank you, sir.
Thank you.